So that said, let's just open it up, and I don't think we need to do this in any order. You want to say something more?
I think maybe what we found at some of the other roundtables, if it's okay with you, Cheryl, is to have folks maybe talk for like a minute or two as we go around, and then just to make sure that everyone gets a chance to be heard. Is that okay? Would you like to?
That's what I meant.
I'll keep track of the time. So about 1, 2, 3 minutes, and then I'll keep track of the time. So I want to give everybody an opportunity to chance to see something.
So relatively new in my position, so forgive me. But as the executive director of the Minnesota Asian American Health Coalition, our focus has largely been around the data piece, and so I really appreciate that you recognize the need for improving data collection. And I had the opportunity to meet with Laurie when she was working under Senator Kennedy, and she did share with me that there was there's efforts at looking at how the data that does get collected on a federal level will be able to take a look at each other, and so you can compare between data systems to understand the health. What I just wanted to share was that the Asian Pacific Islander category, in which we're often reported, comprises of over 40 different unique languages and cultures. And even if you take a look at the single culture, which is relatively small, of people from Laos, there's over 60 different ethnic communities that come from there with different languages and cultures. And so when you think about the large continent of Asia that we all come from, and then break it down to the political boundaries, and then think about the actual communities that make up the communities, the way data is being reported is very challenging to say a large category of Asian, and to say that we all meet this model minority myth is very inaccurate, and I think most people understand that today. I also, as a part of the data piece, I just want to mention that in the Healthy People 2010, I know that we're getting ready for Healthy People 2020, but there are 22 leading health indicators to understand how each community is moving along and meeting these indicators. And of that, 7 of the 22 have no data around Asians because there's just not enough data available. And so I think within looking at better categorization of the Asian community, there also needs to be a look at how can we better capture these smaller communities. I know Minnesota's state legislature approved some additional money to do additional reach for the behavioral risks behavioral risk factor surveillance survey. And so I think that efforts like that need to happen, where there's funding and opportunity to capture better data within these smaller communities so that we can know the status, because as we know, resources are all, and advocacy is all based on the data that we know about our communities. And then lastly, I just want to share this report, because we don't have a lot of hard data about our communities. We have collected testimony and stories of how health disparities has been affecting our communities, and so I just want to share that report with you and your staff.
Thank you.
Thanks.
We're going to go that way.
You're going to go this way? Okay.
Again, my name is Makeda Norris. I've been working with the Eliminating Health Disparities initiative funded by the Department of Health and the Office of Minority and Multicultural Health for 8 years. My area is youth development, healthy youth development, in terms of the teen pregnancy piece and STIs and HIV. I've also represented the Urban League in other areas dealing with health disparities. We have what we're calling a Eliminating Health Disparities sustainability work group with some of the grantees, the communities. And one of our concerns is, again, regarding the collection of data. And we are concerned about how data is collected. We are particularly concerned that there's only 1 or 2 ways to collect data, and that's with the charts and all of that kind of thing. We would like to see the data collection open to where we also look at the stories of people and their narratives, and how that really count and be a part of the data collection, because we believe that a lot of data is missed because of the way that data is collected. We are also concerned about the leadership in healthcare, and we would like to see that leadership be open to more people of color and American Indians. We have a lot of our healthcare and the authorities and those kind of people don't represent the people that they are trying to serve in terms of eliminating health disparities. So that's part of our main concern.
Thank you.
Well, Congressman Ellison has been a very outspoken advocate for HR 3200 and for the reforms going on in the House. And there's that nice section in there about addressing healthcare disparities, but it's written so generally. It's very wide open. And I know we're talking a lot about data collection and how that would happen. We were hoping that by now the debate would have shifted over to that section of the bill, and it never really did. Congressman Ellison held a forum back on August 1, and many of the people in this room were participants in that. And during that discussion, a lot of it was concentrated on the resources and getting them to the right places and what those resources should be. And a lot of it was basic coverage, and also was preventative care. We were kind of surprised at that. That's where a lot of those conversations ended up shifting, was getting the preventative care to help, get people into the system, comfortable with it, to know what resources are available, and also easier to identify what resources are still needed if people are coming in at an earlier point. So there are families and those who have experienced long-term unemployment or employment without health insurance who just aren't going to the doctor for years on end. And it's to get them into the system was one of the things that was identified.
You say that surprised you. Why did that surprise you?
We thought it would be more about that there isn't this in our neighborhood, we don't have access to this in our neighborhood, this isn't affordable in our neighborhood. That's what we were expecting to hear. That just isn't the direction that we thought the conversations were gonna end up going, but that's the way that it went. Pleasantly so. I mean, we wanted to hear from the community what they felt were the real needs here. So, another thing that Congressman Ellison is focusing on right now is the census, because a lot of the data that's used in these studies, or if health reform passes and the Secretary of Health and Human Services is in charge of assembling the panel to identify health disparities and to address them, they're going to be using census data. And when we looked at the 2000 and the 1990 census data, there are pockets here in the Twin Cities that are vastly underrepresented. They just didn't respond to the census back in those decades. So we're doing a big push to try and make that happen, and we're using healthcare as kind of the tool to tell people how important it is, how many resources are allocated based upon that data.